Well, Dr. Emily, please tell me about your background and what led you to start up Naboso and what created your passion, your spark in this field.
Yes, absolutely. So I am trained as a podiatrist, was trained as a surgeon. I am, however, a functional podiatrist. So that means that I look at the body from a very integrated perspective. My passion is within the sensory side of the human foot. In addition to being a functional podiatrist, I'm a human movement specialist. I've been in the fitness industry for over 24 years. I own a education company for health, wellness, fitness professionals called EBFA Global, and that has various certifications and courses all about feet, foot to core, fascial integration, the sensory side of the human foot and human movement. And then essentially it's that company that led me to create Naboso, which is my products company. So I own three businesses. The goal of Naboso was to find a way to help people activate the sensory side of their foot. As a functional podiatrist, and just my approach in human movement in feet is that our feet are a very powerful sensory gateway into our nervous system. Most people look at the foot from a biomechanical perspective. I look at it from the sensory side, which in my opinion is more powerful. Sensory really is what guides movement or motor output. And now that is essentially it. I'm on a mission to help people optimize the sensory side of their foot, prioritize foot health, and really unlock the power of the foot in movement and longevity.
Hmm. That's amazing. So the big toe, ankle mobility, big toe mobility, like how important is that in terms of driving locomotion, driving a person through their 3D experience?
Right. So walking is going to be the most foundational functional movement that we do every day. So if you want to live a long, healthy, high quality of life, fruitful life, you have to be able to walk, but you have to walk in a certain way. You have to walk fast enough. In order to walk fast enough, where walking speed is actually a predictor of morbidity and mortality, to maintain a sufficient walking speed for longevity, you have to be able to take long steps. To take long steps, you have to have balance. You have to be able to balance on one leg. And then two, you have to have sufficient range of motion in your hip, in your ankle, and in your big toe. If you start to lose range of motion in those joints, here we could focus specifically in the foot and the ankle, the big toe and the ankle, then you will not be able to take sufficient step lengths to create the desired walking speed. You will start to compensate. Most people turn their foot out, they drag their leg, they start to shuffle or march, they change their gait pattern. And the gait pattern actually takes away, it's called a counter motion or a reciprocal, where the right leg steps forward, the left arm swings forward, your pelvis rotates one leg, your rib cage opposes it and swings the opposite. That's a very critical part of how we ambulate. That is hard to see with the naked eye, but is a critical part of how you hydrate fascia, how you create these circulatory pumps, and then how you take sufficient step lengths.
How much do you see compensation in terms of like, let's say, an over rotated or flexed, pelvis, hips? How much do you see like a variance in leg length? Maybe like one of the legs is more of a driving leg, the other is like more of a swing leg. Like, how much do you see these kinds of things?
I see every asymmetry in my office. So a critical part of my practice is doing a gait assessment on every single patient. Honestly, I used to do this in my practice, even if someone would have an ingrown toenail. I would observe their gait pattern to then help them understand what is feeding, why they're presenting. So yes, gait asymmetries I see all the time. I believe that humans are just, as we hit a certain age, almost everyone will be to some degree asymmetrical in our movement patterns. And then what that does is that creates asymmetrical step lengths, asymmetrical contact time, asymmetrical arm swings, and then that is loading your fascia and your muscles and your joints a little bit asymmetrically or not balanced, which can then lead to tissue stress, joint stress, and then injury or joint wear and tear, right? So that's what I find a lot, that is you can try to achieve as much symmetry. Now, where this becomes a little bit difficult is in athletics, because most athletics by design have a dominant side. You throw with a certain arm, you swing a racket a certain way, right? So asymmetries actually drive a lot of athleticism, which when someone is in the peak of their athletic career, you actually don't want to unwind the asymmetry. But once they leave, then how can we find as much balance as possible? I call it you're essentially going behind or below this threshold line, right? You're just trying to decompress the system a few degrees or a few millimeters to then create a little bit more balance or symmetry. You will never be able to go back towards perfection of symmetry. I don't think that that exists. But how can you decompress the system to minimize stress to for support longevity?
So, in the past, I've had these obviously asymmetries as well. I've been highly athletic, and it would lead to injury sometimes. And I would go to a chiropractor, I would go to an acupuncturist, and they would fix the asymmetry. What kind of degree of fixing that asymmetry is there, like, that's possible acutely? And is it possible? And how long will that stay?
So I would say that that would be an example of decompressing the system, putting you towards balance or symmetry, is what you had said. As soon as we start moving, though, the asymmetry is going to come back, right? And for the listeners, they could think of things even as if you had a preference of you sit with your legs crossed. Okay, what leg are you going to cross, right? How do we get in and out of the car? There's a dominance there also, right? Which leg are we driving with? I lived in New York City for 20 years. I carried my heavy bag on my left side for 20 years, and I would swing with just my right arm. That's an asymmetry dominance that is very hard to forever reverse, right? And that's why I say that it is a moment of just decompressing the system. And then we fall into these habitual patterns that have asymmetries inherent within them.
All right. So at the gym, I see this, we call it imaginary lat syndrome when the guys, are like walking around like this. But even more than that, I see a lot of bodybuilder types that have their feet kind of splayed outwards. What is the long-term effect of that? Like, how does that play out through this posterior chain? Like, yeah, it may seem like, I don't know whether it's something because of their training that's happening, or it's just something that they adopt to maybe like kind of make themselves look bigger. Whether it's aesthetics or it's functionality, I'm not sure. But how does that play out over time?
Yeah, so what you're describing is kind of a abducted duck-like stance, right?
Hmm.
For them. And some of this will be just my theory on this is that, a lot, and being in the fitness industry, a lot of people emphasize the importance of externally rotating the hip when you're targeting the glutes, which may be part of what it is that they're so dominant in an external rotation because they are trying to really hit the deep muscle fibers to hit the aesthetic shape and the hypertrophy of a muscle, right? So they want to move in the dominance of that muscle. What happens is that if you become very locked externally, so when you externally rotate your hips, your pelvis will start to tuck under, and then you can lock the sacrum. What happens when you do that is that your pelvis, or everyone's pelvis, is designed to counter rotate. And part of that is that you have to have a slight lordotic curvature within the sacrum and in the pelvis and into the lumbar. And the lordosis is what unlocks your SI joints. If your SI joints can't unlock because you're externally rotated and posteriorly tilted in the pelvis, then you cannot counter rotate. Essentially, what I'm trying to say is that it becomes very difficult to walk in this ideal way that you could imagine, with long strides and a rotational counter rotation of the arms to the pelvis and the T-spine, because the SI joints are locked. What happens, and I see this a lot in that posture, and it's not just in people who do bodybuilding, but in that posture of an externally rotated locked sacrum, is that you can't get the fluidity of good hip extension and a opening and a rotation of the pelvis to take long steps. So they walk a little bit lateral in it. So there's this undulation, almost like a bell kind of going to the side, that they're stepping to the side versus going more lengthwise in the sagittal plane with their steps. Essentially what that does, that creates a lot of joint stress. Your pelvis has to be able to rotate. There's this wonderful book, I'm not even going to try to pronounce the author's name, but it's like Cheskoski or something like that. And it's called The Spinal Engine. Just look up The Spinal Engine. And it is a book around the biomechanics of the spine during locomotion and these rotations that happen up and down the spine. And that gait is actually a rotational moment. We see it as sagittal because you're going from point A to point B, which means you're going forward. But within that forward movement, there are many, many, many rotations and counter rotations that are happening from your subtalar joint through your tibia to your femur, to your pelvis, to your spine, all the way up. And the purpose of that is that your head stays level so that your eyes and the visual field in your vestibular system can stay balanced within the gravitational field that we're in, so that, one, you know where you're going, you stay level, but you also don't get discombobulated within gravity, right? Where the vestibular system is very important. If we didn't have all of those counter rotations happening from the ground all the way up to the head, then essentially you would not be able to keep a flat vision. So it's a wonderful book. You don't see that in people who have a locked pelvis or a locked T-spine or a locked ankle, or you could even go to the big toe.
Yeah, I love the rotational stuff. This type of training that I was doing, it was called orthokinetics, and maybe going further back, like Paul Chek did a lot of work around this, and I love those kinds of discussions, like around training where you're doing rotational work with your resistance training. Fascia. I don't think people appreciate what fascia is, what it does, how prevalent it is throughout the body. Maybe there's no fasciologist, if you will. And maybe there should be, and even the crosstalk it has with other tissues. Can you tell us about fascia and how important it is?
Yeah, so what I think is fun about fascia, because I was just at a fascia summit, is that professionals who are in the space of movement, performance, body work, etc., will speak about fascia in a slightly different context, which just adds to the beauty and the complexity of fascia. So the way that I look at fascia, as someone who very much appreciates the sensory side of human movement, and then of course the feet and the foot to core, is as an extension of our brain. Fascia is a connective tissue web that wraps around every single part of our body, our muscle groups, our muscle fibers, our fascicles, your joints, your nerves, your blood vessels, your bones. Everything is surrounded by this saran wrap, which is just in continuity of every part of the body. It is packed with over 100 million sensory nerves. 100 million sensory nerves are within this internal spider web of tissue in your human body, which means it is sensory seeking. It is an extension of your brain. It wants the data, it wants information. It is providing information to your nervous system to continuously regulate and control your entity, this canister that we are in, both emotionally and from a movement perspective. So exteroceptively and interoceptively. How do we relate to the external environment? How do we relate to the internal environment? That is a very sensory-based product that is on constant monitoring and assessment and calibration and where we at, we're continuously adjusting. That's based off of that tissue. Also, because your fascia has so many nerves, fascial communication is very fast. So our feet are connected to our deep core pelvic floor through a fascial line, which then runs into your diaphragm, up your neck to your tongue. And these fascial lines are fast, which means the way that your foundation, your feet, communicates to your center of mass, your core, is very, very fast. It's rapid, it's anticipatory, and that's how we need to tap into our posture and our stabilization when we move. But you have to train it that way because sitting, injury, surgery, all these different things start to disconnect that innate connection. We just need to reawaken it to then move the way that we were designed to move.
So you brought up pelvic floor. I'm hearing a lot about that, certainly with reproductive health, intimacy, urinary health. But how might the pelvic floor or even the sacrum play out in terms of posture and movement and athleticism, et cetera?
Your pelvic floor is everything. This is for both men and women. So your pelvis, pelvic floor, right? Your center of mass, your center of gravity sits between your hip bones. It's essentially what you could say. It's your ASIS specifically. But you could think between your pelvis, which is where the front of your pelvis is where your transverse abdominals sit, your TVA here. And then the base of the pelvis, which is your pelvic outlet, pelvic floor, right? Your pelvic floor is an anti-gravity muscle. Gravity comes down. Anti-gravity means that we have a little bit of a lift, right? And proper posture is really fascial based. So when we are communicating with gravity, we are in touch with our posture, we have an ease to our posture, right? There's an element of a lift to it, which is the fascia in your pelvic floor. So there's a lift. Your pelvic floor is like a spider web that connects to all these other tissues within your pelvis or your center. So if your anterior pelvic floor, the front of your pelvis, which blends into your transverse abdominals, you have your posterior pelvic floor, which is your levator ani muscle. That connects into the deep sacral fibers of your glute max. Your posterior pelvic floor, levator ani, blends into your deep rotators of your hip. So it's obturator internus, but it myofascially blends into like the rotator cuff of your hip joint, which I just think is such a beautiful connection, which radiates this way. And then your entire pelvic floor radiates up and it connects to your diaphragm. So we have this. If you continue back down, you have a muscle called your psoas, which is one of your powerful hip flexors. That comes down, but then it goes back into your anterior pelvic floor. So we can hopefully already start to appreciate this spider web of connection that comes out of and feeds into your pelvic floor. So proper stabilization has to be really pelvic floor up or pelvic floor out, but then your pelvic floor connect to your feet. So your feet really kind of activate this whole cascade. And then the fact that it feeds into your diaphragm is really, really important because the way that we breathe and the timing of how we breathe influences then our center of gravity stabilization. It's a timing game. When I teach athletic trainers, strength coaches, where you're thinking a lot of athleticism and quick movement, I really emphasize that this is a timing game. How quickly does the athlete perceive a shift in their center of mass? That's really the lowest hanging fruit, right? Is, okay, I have a shift, but it's the timing of the perception of the shift and then the response to the perception of that shift. That's how we have to train faster athleticism. And a lot of that feeds from the ground, which is why we have to wake up the sensory side of the foot because it's a deep connection to the center pelvic floor and the timing of the perception of how they relate to each other. Essentially sum that whole thing up and say, you're only as strong as you are stable is essentially what it is. So we have to be able to tap into our stability faster.
Got it. So Most people have heard about acupuncture. I'm not sure where you land on that, but acupressure, maybe that's more viable for you. I'm curious because, you know, you do have these insoles that have kind of this, as you mentioned, nervous system or electrical system feedback, if you will.
Yep.
And we could even talk about proprioception, which you're kind of alluding to, maybe. What do you think about the feasibility of acupressure, and how would that align with maybe some of the tools that you have?
Great question, and I get asked this a lot. So I want to differentiate kind of these different nervous system stimuli, I guess we could say. First one that I want to differentiate, if you don't mind, is proprioception and mechanoception. So those are actually very different, and they fall under what's called exteroception. So just exteroception as a parent term means your perception of your body as it relates to the external world. So that would be then utilizing exteroceptors such as proprioceptors and mechanoceptors. Proprioception is an awareness of your body in space. For the sake of this, I'm going to say as it relates to joints. Okay, so joint position sense. Proprioceptors, which are nerve endings in this connective tissue spider web I talked about, wraps around the joints. So it's the joint capsule, which then radiates into ligaments, retinaculum, tendons, periosteum, and then more of the fascia that comes into the muscles. So that's proprioceptors, which feeds into joint position sense. We have so many joints in our body, so every subtle shift of a joint is essentially triggering a proprioceptor, which is then feeding into the totality of where is your body in space, which the perception awareness of your body in space and the visual image that your mind creates is called body schema. It's a mental picture of your size and shape in space. And then that schema continuously shifts based off of feedback of these joint movements and proprioceptors to this. Hopefully that makes sense. One example of how you can stimulate proprioceptors is through compression. So if you put like a sleeve on your elbow, a brace on your knee, you are stimulating proprioceptors. You also stimulate proprioceptors when you hold something that is weighted. So like, at Naboso, we have weighted sticks called sensory sticks. You can have wrist weights. When you hold something in your hand, even your cell phone will do it. That if you hold your cell phone and you stand up and your arms are hanging by your side and the phone is in just one arm and you shut your eyes, you will feel the subtle difference in your perception, the visual perception of your arms with the one that is holding the phone because of the weight. And it is subtly pulling on every joint, stimulating the brain. Okay, that's proprioception. Mechanoception is touch. They are nerves that respond to mechanical deformation. That's their definition, but they are touch nerves. So you find mechanoceptors in the palm of the hand and the bottom of the feet. They respond to different stimuli. Vibration is one of the most important stimuli that mechanoceptors respond to. That is in our feet. That is ground reaction forces. Every time your foot strikes the ground, you feel vibration, stimulated mechanoceptors. But then texture is another one. Texture, which is Naboso, is mechanoceptive. When you read Braille, you're stimulating mechanoceptors in the fingers, which are sensitive to two-point discrimination. Naboso stimulates the Braille nerve in your feet. So two-point discrimination, mechanoception here. Acupressure and acupuncture are a little bit different. Acupressures to very specific points in the foot. I am not trained in acupressure. I'm not trained in reflexology. It's a different approach. To me, it's a little bit more Eastern philosophy. Mechanoception, proprioception are Western philosophy, you could say, I guess. There is a difference between standing on something like the Naboso mat, which is like Braille or Naboso texture, and the acupressure mats, where they're the hard plastic spikes, right? I also have a nail board. Someone sent me a nail board, so I do nail boards at night. The purpose of acupressure mats, nail boards, right? So you're thinking, okay, this is a stimulus to the feet. How is that not different than this? Is that you are trying to tap into the mindfulness and the autonomic nervous system, how you relate to the stimulus. Can you stay calm? Can you consciously regulate the state that you are in and your reaction to the stimulus, right? Can we down regulate to that stimulus? Totally different than mechanoception, right? So I tell people that all of these methods, proprioception, mechanoception, acupressure, acupuncture, reflexology, they are all synergistic and complementary of each other, but one is not replacing or taking the place of the other. They're all interplaying with our nervous system.
All right. So that was amazing. I have some these will be kind of quick hits. So, whole body vibration, good or bad when it comes to the feet?
I absolutely love whole body vibration, and there's so much research supporting it. Circulation wakes up the muscles, wakes up the nerves, builds bone density. You can just sit in a chair, put your feet on whole body vibration, do 10 minutes, boom, you're getting the effect. I have one in my office and I recommend it to most of my patients.
Okay, awesome. How about barefoot shoes?
Love barefoot shoes for the fact that they unlock the natural motion of the foot. You get as much sensory stimulation as you can. For most activities, I like it. For most feet, I like it. However, not every foot type can actually tolerate them. There are exceptions to every rule. I will tell people that when they transition to minimal or barefoot shoes, to do it in a controlled environment, such as your workout or the gym. That's a great place to transition into minimal shoes. And then do not forget foot recovery.
For example, if you're a basketball player and there's jumping, and maybe you're someone who's my size, I'm 6'3", 225 pounds or bigger, is that too much impact on the foot to expect from the foot? Does it make sense to have more of these air cushions and things like that?
So, what I tell people when we have the conversation of impact forces and size and mass and acceleration is, so when we walk, our foot strikes the ground 1.5 times your body weight. Boom. So take your 225, 1.5, right? That's what you're experiencing. Start running, it's 3 to 4. Start jumping. Okay, now we're talking about basketball players. We're jumping 10 to 12. Gymnasts tumbling up to 18 times.
Mhm.
So, what it is, the story of impact and injury is you have to train your nervous system, train your myofascial system to respond, actually, to anticipate, respond, and utilize the impact forces efficiently over and over and push your fatigue point as far away as you can. The reason why gymnasts can take 18 times their body weight is that they've been trained how to harness it, how to utilize it, and then how to release it. If they weren't doing the tumbling pass into, just picture Simone Biles, right? Triple back turn, etc., right? Is that she would get injured, but she is essentially a transfer conduit for these impact forces, and she is releasing them almost at the exact same time that she is absorbing it. So they are transferring through her body very seamlessly. We need to train other athletes to do that as well. So there's an inherent repetition of basketball. Sure, I understand the role of cushion. There's a lot of extrinsic variables in basketball that you don't have in gymnastics, which are other feet and other legs that you're potentially landing on, which is part of why you have such a high injury rate in that sport, is it is extrinsic factors, not intrinsic.
Mhm. How about I won't even address like high heel shoes because I'm trying to your answer there, but how about like these Balenciaga, some of these crazy shoes that are three-dimensionally massive, that are like 4 inches off the ground with tread, that seem to be locking the foot into place. What are your thoughts on these trendy shoes?
Oh, trends and fashion, they will always try to defy function, which I think is part of the definition of fashion, as they try to defy what the human eye thinks is functional or achievable. So it's intriguing. Functionally, though, long term for the foot, not good, right? We don't want to be in lots of stack, lots of cushion, rigid, stiff, locked shoe. So for the people that are wearing those, I would say make sure you are balancing it by doing some time barefoot. Make sure you take your Pilates and yoga class if that's how you're essentially reversing it. Release your feet at the end of the day. When you're at home, definitely take your shoes off and be in something that is then supporting the natural side of foot health.
All right. What are your top three favorite shoe brands?
So they're going to be minimal.
Mhm.
So my favorite, this is my personal favorite. I recommend many, many different types of shoes. So this is my professional or my personal, not professional, my personal preference on it. Paluva, which is a 5-pocket shoe, very similar to Vibram Five Fingers. If people remember those from 2008, 9, 10, around that time. Paluva is great, slightly different design, has a little bit of a drop, a little bit more cushion, so you can just wear it a little bit longer. Zero Shoes is one of my favorite, partly because I absolutely love Steve Soshin, who's the founder, and I love what he has created for the category. So I will always stand behind him. I don't know if I can just say three. Vivo Barefoot, awesome, great athleisure, very well designed. So if you're looking for kind of the premium aesthetic design of a minimal shoe, one more I will mention as a bonus is Origo. So these are made of natural materials. The Origo part of it is kind of an organic side. So really great designed athleisure shoes. So some of the downside or hard part of barefoot minimal shoes is a lot of them will tend to be sneaker like. And then people are like, well, I believe in the philosophy of minimal and barefoot shoes, but I don't want to wear sneakers all the time. So that's where now you have these other brands that are opening up into other types of footwear that still check the boxes of barefoot and minimal shoes.
Amazing. All right. So, quick hit again. Three things that you would recommend that normal people stop doing to fix their posture, their gait, their back pain, etc.
I would say stretching your calves. I think people overstretch their calves on those devices that stretch. I would say instead do self myofascial release to the bottom of your foot, which will actually blend into the fascia of your posterior group or your calves, and you'll get a better release than just stretching your calves. Two would be sucking in your stomach. That creates a abdominal imbalance, and you can actually inhibit your upper abdominal muscles. So you don't want to just suck it in as much as you can to look taller or thinner. I don't know. And then third one for posture is, I would say, stop falling into gravity and instead try to feel and connect and have a synergistic or a symbiotic relationship with gravity, which means just become one with gravity, as cheesy as it sounds. Become one with gravity as you stand and when you move.
Mm. All right. So, three things to start doing, especially for the athlete, that could be like a game changer in maybe in 1 minute, 30-minute session. Like, what's something that like you could take away right now that could change your athleticism today?
Release your feet, preferably with the neural ball. So you're waking up the nerves at the same time. That takes 2 minutes to do our 5-point foot release. Two, activate your toes. Very, very important. Your toes are what activate your pelvic floor. I teach this through an exercise called forward lean, where you lean forward and it activates your toe. And then three would be activate your single leg stability. Really, most athletic movements, quick running, long steps, etc., requires the ability to stand on one leg. Can you wake up your balance and stand on one leg for 10 seconds?
Okay, awesome. All right. Maybe my last one would be the psoas. I hear a lot of you mentioned it before, like the iliacus, the psoas, like we're all sitting in chairs a lot, and the sitting syndrome is more dangerous than cigarettes and all these things that we've heard. How how bad is this psoas situation? How much do you see it playing out? Is it much bigger picture than that? Like I guess what are your thoughts on the psoas when you hear someone say, oh, that's a psoas thing?
So I look at the psoas and how it relates to your adductors and your TFL into your pelvic floor. So I see more anterior hip. So the psoas is in your groin, right? So it's your anterior hip joint. And that imbalance of those muscles, those four, your adductor, specifically your adductor longus, your psoas, your TFL, and then how that relates to the pelvic floor. Those muscles, if you lose the coordination of those muscles, that puts a lot of strain and stress onto your anterior pubic joint. And I've experienced this, so I have some experience on the injury related to the anterior joint as I ruptured my rectus abdominis, which is called an athletic pubalgia or sports hernia. And I did this through training my abs like a gymnast and doing competitive cycling. So I was very dominant in my hip flexors and my psoas, and it essentially led to this rupture of my rectus abdominis. So it took a lot for me to understand how to get the psoas in relation to those four muscles, right? All four of these muscles to get the timing back in order. That's where I would put the emphasis on this answer, is it's not just release the psoas, stretch the psoas, wake up the psoas, but it's how is the psoas timing in coordination with these other muscles? And if the coordination is off, that's where you start to get this shift in stress. And that shift in stress will be on a joint, on a tendon, on fascia, and that's where your injuries result. So I always go step one, I'm always going into inhibiting muscles, activate the pelvic floor. Inhibit these anterior muscles, activate the pelvic floor.
Amazing. Okay. Well, that's all. I'm finished with all the questions. That was incredible. I love your knowledge.
Yeah.
I'm even more interested in diving deeper on some of these tools that you have. I have a couple, but I need to start using that ball. I like that a lot.
Yes.
Um, Actually, so maybe this would be good because you do kind of have this, but the balance boards,
Yeah.
what are your thoughts on those? Like when I was in Costa Rica, I was surfing and I was learning how to, I'm almost, well, at the time I was almost 50 years old, and how to balance on the surfboard, how to pop up. I had snowboarded my whole life, but as a teacher pointed out, he's like, "Does the snow move?" And I was like, "No." So that's a harder part to surfing, and a balance is obviously a huge part of this. So I was working on these balance boards. Um, what are your thoughts around balance boards? I think I know the answer, but should everyone be doing this kind of work? How does it play out in day-to-day life, even if you're not a surfer or athlete or gymnast?
Yep. So balance is critical to functional movement. We have to be able to balance on one leg, and we're balancing on one leg on theoretically a stable ground, right? So part of how I look at balancing is that it is a skill. It is a skill that must be continuously strengthened and challenged regardless of our age. This is not just for athletes and not just for people over 65 or 70 to reduce falls, is that we need to challenge that balance and create that skill. Now, to challenge someone's stability on a single leg, as an example, on the stable ground, does not mean that it becomes more difficult by putting them on more unstable surfaces, right? So you just bring in different surfaces that are harder and harder, and that is how you challenge someone's skill at balancing on one leg. You do it by understanding the role that the visual input has, the vestibular, cognitive dual tasking. How do you interplay with those? Eye-hand coordination. So before I progress anyone from a surface perspective, I do eye movement exercise. I do vestibular stimuli. I perturb them through dual tasking. I perturb them through eye-hand coordination. So different things which translate how that individual will use balance and stability. And most of it is within the visual and the vestibular that you can challenge someone.
Mm.
Once they've demonstrated that level of the skill, then we bring them onto a surface that then matches the next level of progression. So at Naboso, we have a kinesis board that has a micro wobble. So they're 1-inch pieces of foam that create a micro perturbation. So our foot does this subtle invert evert as we're walking, as we turn, as we rotate. There's a subtle movement to the subtalar joint in the foot, which creates rotations up the leg. The kinesis board transfers these micro wobbles to the foot and the ankle. And just trust me, from the years of demonstrating this, is go onto the kinesis board with a micro wobble and you perturb someone's visual and vestibular. That board is way more challenging than they think by looking at it. People think that they need to be on a BOSU, an Indo board. I'm sure you've done the Indo board, hard wobble boards, Dynadisc. We're thinking of things that are more and more challenging. Why don't I stand on a physio ball, right? All of these things are essentially skills. And you want the skill to transfer to that individual's activity or their daily function. Most people's skill level does not require the demands of standing on a physio ball. That doesn't transfer to the foot and ankle stability that is required to walk day-to-day movements. So what I tell people is also, if you stand on a physio ball as an example, or you're standing on a wobble board or a BOSU, initially not so good at it. You do it over and over, you get better at it, right? You are improving a skill, which means you are improving your ability to figure out the strategy in your nervous system, visual, vestibular, proprioceptive, mechanoceptive, to stand on the physio ball. And that's it. And as someone who's done aerials and all the circus stuff, you're learning a skill like a circus trick. That does not mean that you will not sprain your ankle when you're walking down the street and you misstep off of the sidewalk and you get a, right? Because you didn't train that type of a skill.
Hmm. Perfect. Okay. Thank you. That was amazing. I have tons of great stuff from that. So I appreciate it, Dr. Emily.
Good.
Thank you for your time. Those are amazing
Of
answers.
course. And I saw Gabby entered to send this to you today.
Oh,
My
cool.
book. Yeah. So
Oh,
you'll get,
amazing.
you'll read more of some of the stuff that I talk about. I'm very into like body schema and things
Mhm.
like that. So enjoy the book.
Oh, amazing. Thank you so much, Dr. Emily. I appreciate that. Have an awesome day. Thank you
Thank
for jumping
you.
on. All
Of
right.
course.
I'll talk
Thank
to you soon.
you. Okay.
All
Take
right.
care. Bye.
All right. Bye.